Welcome back to the True Sports PT podcast. Today's guest is Dr. Ben Moxness. Ben has been a PT for like 5 months and still he taught me a ton today. I've been a PT for 15 years. He's been a PT for 5 months. He knows so much about jump and sprint mechanics, and we get into all of it today. He is the guy to help you get your athletes more explosive and injury-free. He went to Doane University, got a degree in exercise science, and then graduated from PT school at the University of Nebraska. He is an online coach at THP Strength. Check out all of their program. It is elite. I'm looking forward to taking it rather soon. Without further ado, here's my conversation with Dr. Ben Moxness. Guys, welcome back to the True Sports PT pod. Today's guest, Dr. Ben Moxness, is all things jump. He is probably the most explosive doctor of physical therapy on the planet. You're welcome. I read that in your bio, so I didn't make that up. I think you put that in your bio, Ben.
True. Yeah.
Okay, true. Do me a favor. Give me and our audience a rundown on your background and how you got to where you are today and what your day looks like.
Yeah. So, like you said, my name's Ben Moxness. I'm a physical therapist and performance coach for THP Strength. That's based out of Florida. So we're all online. I work primarily with jumping athletes in volleyball, basketball. We're probably most known for our pro dunkers and track and field. I mean, our population's from junior high to high school, college, all the way to pro, and even some Olympians every once in a while. So pretty wide range there. In terms of background, like I've been into the jump training space ever since I was 13. I've been training for vertical jump ever since I was 13. Got my first dunk when I was 14. I played all the sports growing up, like football, basketball, baseball. I ran track in junior high. My main love was basketball, though. So I've been into the jump training since I was 13 and into sports performance since I was like 13, trying to just consume as much knowledge as I can on it. I played basketball in college at a local university here in Nebraska. Then I majored in exercise science, went to PT school. And then right before my first year of PT school, I started my Instagram page. And in PT school, in PT school, that's what really ignited my passion for learning. And I read like multiple research papers every day for like 3 years straight because I was kind of bored in class. So I kind of just wanted to do something. So I was just in the back of the class reading research instead of playing solitaire or whatever. So and then I ended up, so I graduated from PT school, and instead of going into in-person PT, I went to work for my mentor, John Evans. He owns THP Strength, and that's where I'm at right now.
Okay, and so what does your day look like? Because I'm always interested in what we can do with this degree. So what does your day look like? You have a gaming chair, so I assume you spend a lot of time in that thing.
I don't actually. I do a little bit of gaming. I used to be more of a gamer in college.
Okay.
This is mostly just for comfort.
Okay.
But my day is pretty much mostly spent messaging athletes. So we have a lot. I mean, we have like 2,000 plus athletes worldwide. So it's a lot of texting and some calls, and I'll like programming. So that's most of my day is messaging athletes, programming for them. And then the other half is doing content and working out pretty much and reading. So I do I'm pretty much always enrolled at a course at all times. So I always get through some sort of course, on maybe like a monthly basis. I still read a lot of research. I read a bunch of books. So that's kind of like my day.
I hope you're in the middle of the True Sports ACL course because it's a must take to all.
I would love to learn more about ACL rehab because like that's something that I don't get to see as much now that I'm not in the clinic. So
yeah. Well, we'll take it. Find it on our website. Happy to give you a discount code, and to everyone listening, the same. Okay, so we were talking off air, kind of the evolution of jump training, and then how that relates to what we do as sports PTs every day. Like I was telling you, like old time stories of like, I remember when my first clinic director brought in a box and he's like, we're going to do box jumps. And I'm like, oh my God, like my head exploded. And so like, we've come a really long way from that. How should a sports PT think about incorporating the concepts of jump training when dealing with diagnoses like patellar tendonitis, quad tendinopathy, Achilles, etc.? How should we think about it?
Yeah. So first thing to think about is jumping is extremely intense. I mean, that's why we have jumper's knee and Achilles issues. And I think sometimes where clinicians fall short is they just do like box jumps or they'll just do some like 12-inch depth jumps. But that does not match, that does not even come close to matching the demands of actual jumping, especially max effort approach jumping. So when we have athletes with jumper's knee, we do a lot of like true jump progressions. We will start them on a box jump, like, a one-step box jump, but we try to get rid of that box as soon as possible so they can actually experience the landing, maybe work on some landing mechanics. And then we want to just progress them up as tolerated through all the way up from, one step, two step, short approach, all the way to, 70% max effort and then 80% max effort, and then all the way to 100%. Sometimes it takes weeks, sometimes it takes less time than that. But main thing is understand that jumping is intense and just doing box jumps in the clinic, like being pain free, doing a standing vertical jump does not mean that you're going to be pain free or have manageable pain levels doing an approach jump because they're totally different in terms of the demands.
Okay, so by the way, that reminds me of a conversation I had with Q Willie talking about the load of the hamstring that is achieved in the weight room versus what transpires when you're actually max sprinting. So it sounds very similar when we're
Hmm.
approaching the jump. You mentioned a true jump progression. Is that what you meant by true jump progression in terms of your approaches and how you spread those out? What else goes
Yeah,
into that?
yeah, pretty much. Yeah. So like as opposed to just doing a jump progression where it's like, oh, I'm gonna do a band assisted jump, and then I'm gonna do a box jump, and then I'm just gonna do a standing jump. We take it all the way out to actual approach jumps and making sure they're getting exposure to those max effort approach jumps, whether they're a 1 foot jumper or a 2 foot jumper. Because that's ultimately like what they need to be able to do pain free, especially if you're talking about basketball and volleyball. And obviously, I mean, track if they're a long jumper or a triple jumper. So that's the main thing. Yeah.
Okay, that makes a lot of sense. I had thought in past of starting jump progressions up to a box, down from a box, over hurdle. Is there anything I'm missing from that very rudimentary understanding?
No, that's great. Yeah. So we'll start like we'll just do the Jill Cook 4 stage progression. We'll do their ISOs, slow strength, and then make sure they can drop off a box at the height of their max vertical, pain free. And then once they check that box, then we'll start the jumps progression. But in the clinic, if you don't have space, doing a depth jump variation like a drop jump over a hurdle is a good, at least good place to start.
Okay. Okay. Good.
Yeah.
Glad I didn't miss anything there. Um, Doing a deep dive on some of the stuff that you put up online. You do a great job of getting into the differences between a stationary vertical jump and the mechanics of a counter movement jump, say, and then the differences there of the mechanics required for dunking or approaching the net. Can you break those down for me? It's fascinating.
Yeah. So a standing CMJ, I mean, it's a great measure of explosive power, but it's the coordination pattern is just completely different from an approach jump. Like you're not that your standing CMJ isn't related to what your max approach will be, but there's a huge gap. Like I think most people they might jump like 2 to 4 inches higher off an approach, but our top dunkers, dude, they jump a foot plus higher. Like we'll have dunkers that their standing CMJ is good, it's 34 to 36 on a Vertec, but they're jumping 46, 48, some 50, and because the timing and the coordination is just completely different and the capacities you need are just completely different. Like most people can easily just stand in a place, do a counter movement and jump up with pretty good coordination, but actually going in off a 5 step approach off a 2 foot jump is a completely different beast. You need a lot of eccentric capacity, you need a lot of reps, and so you can actually learn the coordination, the timing, and how to hit those positions. Sometimes just being super strong in the weight room isn't enough because you have to actually be able to time everything. It's not just running and jumping. It's a very explosive, very very explosive movement. You got to throw yourself into the floor. It's awesome. It's one of the best feelings in the world, though. I love jumping.
Okay, dude, had I known this when I was playing ball, maybe that would have explained how grounded I was. But can you explain, like you mentioned, some of certainly the eccentric components that transpire with an approach jump. What else is happening from a firing perspective, from a coordination perspective, what's going on at the pelvis that's different in your approach jump versus your standing jump?
Oh, that's a great question. So I associate a CMJ a lot more with compliance. So guys will be able to hit deeper ranges of motion. If you were looking at it on a force plate, a lot of guys that might be successful in a CMJ but not successful in an approach jump, they'll probably just have like one peak. They're not going to have a bimodal curve. It'll be a unimodal curve with likely very low braking or eccentric RFD, probably low braking impulse as well. And that just tells me that the strategy they use to jump higher is essentially just maximizing the time spent applying force in a CMJ. But when it comes to translating that to 2-foot jumping or even 1-foot jumping, it has to be different. Like if you're when you're hitting the floor and you're getting that impact peak, you have to be able to essentially what happens is you'll get a small stretch at the muscle very briefly, because if you create a good pretension, you'll be able to your muscle spindles will be essentially sensitized. Like the gamma motor neurons will contract them, they'll be pulled tight, and so then you'll get a small stretch, and depending on the range of motion you get to, the stretch will be more or less, and so you'll get a small stretch, then the muscle will switch to a quasi isometric state, so where it's basically shortening against the tendon, and this is while your muscle tendon unit is lengthening, and that will stretch your tendon, and it will also load the muscle. And then once the muscle produces enough torque or internal torque to overcome the external torque, you'll start the concentric phase, and then the tendon will release energy, all that stored energy, and the muscle will store it with it, and that's how you get an explosive jump. But it sounds somewhat simple in theory, but to actually be able to do that, like most guys that can't perform an approach jump, the timing's way off. Like they usually create horrible amounts of pretension. Like they either create too much or too little, and they're usually too compliant. So instead of the tendon actually stretching, the tendon will only stretch a little bit, and then the muscle just stretches a bunch. And then so they're way too compliant. They're not very stiff. This is when you see guys that will kind of just run and jump into they'll just jump into a squat essentially, as opposed to deflecting off the floor. They'll have ground contact times over like 330, 350 milliseconds, maybe even more, depending on their level of experience. Whereas like really good 2-foot jumpers, they're getting off the ground like 260. So that's
Okay.
kind of
Fascinating. I just want you to define some terms for me. So number one, you mentioned the curves, right? Unimodal versus bimodal. I want you to get into that, and then I want you to get into what the hell you're talking about with pretension. Like dumb it down for us, Ben.
Okay.
Let me rephrase that. Dumb it down for me.
Gotcha. So unimodal versus bimodal is just single peak is unimodal, bimodal is 2 peak. You can have a concentric dominant bimodal curve where you have like your eccentric peak is smaller than the concentric peak, but usually for explosive athletes, you want the eccentric peak to be higher than the concentric peak, because that means you have high eccentric rate of force development, and that you can load your muscle tendon unit with a lot of energy. And usually it means that you can stretch your tendons way easier. Otherwise, you'll just kind of like collapse into the ground and just use that large range of motion to explode back up. So hopefully that answered unimodal versus bimodal. Okay.
Yeah, I mean, it does. I mean, and then just to even clarify further, you're talking about the force production as measured usually in a force plate. Like you're seeing that curve line up.
Yep.
And so we're looking for bimodal. We're in trouble if it's unimodal. When you talk about eccentric strength, you're talking about, let's say if you're doing an approach jump and you're a right-handed athlete, you're jumping off your left foot, as that left foot comes into contact with the ground to explode you up, the amount of force that you're able to produce eccentrically is going to set you up for a better concentric output.
Exactly. And in a 1-foot jump in particular, it's even more interesting because of the vaulting mechanism, where you're actually, so even though your muscle tendon unit is flexing, your center of mass is still ascending. So your eccentric force actually contributes to your propulsive force, whereas in a 2-foot jump, and like an approach 2-foot jump, it's just the concentric, and the eccentric just serves to potentiate the concentric. So that's why, especially for 1-foot jumpers, I mean, and 2-foot jumpers, but especially for 1-foot jumpers, eccentric strength is massively important, because that force literally contributes towards your jump height.
Okay, so that makes a lot of sense to me. We'll get to pretension in a second. If you see your athlete having low levels of eccentric force, you can pick that up on force plates. How do you pick that up if you don't have force plates with you? And how do we treat that?
Okay.
What do we do
So,
about it?
so obviously force plates are the easiest way to read it, but I don't have access to force plates either. So a really easy way that I just assess athletes even through the screen, like online, is just when I watch them do a CMJ, do they lower slowly or do they lower fast? Like, do they throw themselves into the ground and then come back up, or do they go and sink into this large range of motion? I mean, almost with 90% certainty, they're going to be, if they go through this big range of motion and they don't throw themselves into the floor, they're going to have a very low eccentric number. You can also kind of uh, see it in how well they transition from eccentric to concentric. Like they might be able to drop into, like, say, a parallel squat, but they can like drop and get out of that fast. Then that usually means that they do have high eccentric capacities and they'll have high, you know, breaking power, breaking RFD, like whatever force plate metric you want to measure. But if they lower slowly and they kind of sink down into it, like think, like a football lineman or even like an Olympic weightlifter, maybe is their CMJ strategy. But that doesn't necessarily mean that in the context of an approach jump that they won't be that they don't have those capabilities. But just speaking strictly from a CMJ, it's pretty much how fast they lower and then how fast can they turn it around.
Okay, how do you eyeball that when you're doing these virtual assessments?
Just a lot of practice. And we've also had athletes that have had access to force plates. So you kind of get somewhat, you kind of develop a coach's eye for it of like, oh, this athlete is more eccentric dominant, like they're going to have good eccentric qualities, or this athlete does not. And for the most part, there is probably some gray area, but it's pretty easy to tell right away. A lot of younger athletes aren't going to be able to do it. Experienced athletes who are strong, played a lot of sports growing up, they'll be able to they'll naturally choose a strategy that resembles more what we're looking for. So it's relatively black and white. It's relatively
Okay.
black and white.
I mean, okay, so but if I push you a little bit more on this, like picture the PT in the middle of nowhere, Montana, who's getting into some of this sports stuff, doesn't have this Rolodex like you have in your head of this is an eccentric jumper, this is a concentric jumper, this is fast, this is slow. Smooth out that learning curve for me. What are you going to tell them?
Yeah. So number one, look at their counter movement jump and how fast do they lower? Do they lower quickly? Like, do they throw themselves on the floor, or do they lower slowly and use a large range of motion? Then you can also go over to, say, a drop jump and even something simple like an 18-inch drop jump, and just have them and just cue them get off the floor fast. And you can film on your iPhone and measure the ground contact time. And if they can't get, I mean, I would probably say minimum 200 milliseconds for most athletes. For bigger athletes, it might be a little bit more, but if they're over 250, say, then they're not gonna then they're likely have very low eccentric capacities. So I would say CMJ, and then you can also just do a drop jump in the clinic. You can film on your iPhone, and they gotta at least be less than 250, probably even less than 200 milliseconds on the ground. And then if you're looking at RSI numbers, we want that RSI to be like 2.5 to 3, whether that's off of the drop jump or if you're just doing like a 10-5 test where you're doing 10 standing pogo hops and then you take your 5 best and average those.
Okay. That is super helpful. Now, Ben, tell me about pretension.
Okay, pretension. This is if you're familiar with Franz Bosch,
Yep.
the coach, and he wrote a few books. This is kind of his baby, so to speak. Um, So pretension, your muscles are contracting before they even hit the ground. Now, people get confused because they're like, well, the joint isn't moving. Like the joint's staying at the same angle before you hit the ground. But that's because muscles on both sides of the joint are contracting. It's co-contractions. And this essentially functions to allow the muscle, like the agonist muscle in this case would be like, the Achilles or the calves or the quads, like your triple extenders or your extensors, that allows them to perform work on the tendon and take out muscle tendon unit slack. So your muscles, if you're just sitting here and you just like shake your legs around, they're like jelly. Like your muscles are not tensed automatically. Like they don't sit in like they don't sit in the body like
Taught.
tense and like taut and ready to go. Like you got to take the slack out of the rope to be able to like apply force through with it. And then same thing goes for the tendon. Like the tendon has to get uncrimped, the fibers have to get aligned um to be able to apply force and perform work on the bone. So we do this more efficiently through creating pretension. So before you even hit the ground, the muscles are contracting at like roughly, I think it's like 70% ish of the maximum EMG amplitude. So like a lot of high activity, a lot of high activity. And this allows the muscle to essentially perform work on the bone right away. Once the say the foot hits the ground in sprinting or jumping or same thing with the knee. So it essentially prevents massive collapse because like those forces are huge.
Mhm.
So if you didn't create pretension and you were just relaxed, you would just fold like a chair.
Yep.
Like, you imagine like a parkour athlete that they just collapse and roll. That's kind of what you would do if you didn't create pretension. And the really, really skilled jumpers are excellent at timing this. Because if you create too much pretension, you might not be able to get in the position you want. Or you might hold the pretension for too long because you don't want that co-contraction. Or like, yeah, you don't want that co-contraction to be too prolonged. Otherwise, the antagonist is going to inhibit the agonist from, from accelerating the joints at the fastest rate. So it's a very, very fine tuned system that you develop through just years and years of jumping, of sprinting. And it's something that you just train through becoming more skilled at the specific task.
Okay, so if an athlete is a high level pretensioner, you're going to see them strike the ground and immediately applying force to propel them up, right?
Yep.
Because
They're going to have a high eccentric capacity. Yep.
they're going to have a high eccentric capacity. They have a very taut limb, so they're going to be like a pogo.
Hmm.
Okay, so you're going to pick that up if you're watching an athlete perform whatever given movement by what you're going to see, like their heel doesn't collapse down to the ground. They're staying taut, so they're staying on their forefoot. You're going to see minimal knee angle change as they take off. Anything else?
Yeah. So it's going to depend on the type of jump. If you're looking at a 2 foot jump, there is some degree of compliance that you need to be able to hit that deeper, say half squat range of motion.
Hmm.
So the amount of pretension that a 2 foot jumper creates might be more or less than what a 1 foot jumper creates. But whereas a 1 foot jumper, they're going to have a less range of motion, and they're going to essentially just vault and deflect off the floor, minimal knee angle change. Whereas a 2 foot jumper might create a little bit less, or might create the same amount of pretension, but they relax their agonist just enough to get into that range, and so that they essentially get a little bit more stretch on the muscle, and then they'll switch to that quasi isometric state like I was talking about. Whereas in sprinting, they're probably creating a lot of pretension, especially in co-contractions at that ankle joint, and they're just pounding that thing into
Yep.
the floor. And the best ones that can create that pretension are going to be able to handle the the angular velocities that's being created at the hip. And like that's where we talk about ankle stiffness. It doesn't necessarily mean the ankle won't drop. The heel still will drop because like that's how you stretch your tendon. But the ones that are able to create more force at the hip don't drop more. They drop, say, the same range of motion, but they're taking in more force, so like hence higher stiffness.
Okay, so awesome. Great explanation. Now that you've identified some of the problems or you've given the therapist the ability to identify these problems, how do we fix them in the gym? What is our antidote?
Great question. So a lot of it is so to develop eccentric capacities, plyos are usually the best bet. Now keep in mind sprinting and jumping, like approach jumping, are forms of plyos. But plyos are really, really good. Like any form of that is going to be awesome. I love like bounds, single leg hops. Now, obviously, for physical therapy clients, that's not always the going to be like those are the S tier plyos. Or I mean, same thing with depth jumps. But even just start rudimentary with pogos, with even just like basic skipping can be good, or even single leg hops just at a light intensity. Um, I love for the calf specifically. I like doing dribbles with some of our guys. That's really good for creating pretension if they're very plantar flexed when they're sprinting. Just doing dribbles and like learning how to turn over the feet really really fast and stay in that dorsiflex position. Those are really good. And then, like I said before, just doing lots of sprinting and jumping. Like they'll naturally learn how to coordinate it the more that they do it, and that's why all the best jumpers they have a background in jumping.
Yeah,
So
I
that's
mean,
yeah.
that's interesting. Also, what's interesting is your intervention sounds very neural driven. It's like they're going to pick up the pattern, right?
Yeah, they'll
And
pick up the pattern, yep.
they'll pick up the pattern. Does resistance come into this at any point?
Yeah. Yeah. So then that was going to be the next point is so you develop your eccentric capacities, your ability to actualize your strength with plyos, and with sprinting, jumping. And then of course you got to just get generally stronger. Like we do a lot of calf training. We do a lot of squatting and cleaning, and that just increases the force production potential of your entire muscle tendon unit. I mean, it makes your tendon stiffer. It keeps them healthy. So there are two peas in a pod. Like you can't do one, like you have to do both.
Yeah.
We always say leave no stone unturned. So we're gonna get you as strong as possible. We're gonna expose you to progressively higher and higher intensive stimuli, and it works really, really well.
Okay, so now talk to me about dosing. Like we're so good at 3 sets of 10, or whatever, right?
Yeah, the DeLorean protocol or something. Yeah.
Yeah, it's so painful. But when we get into this stuff, I feel like we're in uncharted territory. So explain to me how you introduce this and scale it, specifically with skipping, pogos, bounds, etc. How do we
So
program
yeah, so I mean, at the bare bone basics, it's start light, make sure they can do it at a light intensity with competent movement patterns, and then they progress to medium, and then to high, and then eventually the good thing about plyos is they self-intensify. So the better you get at them, the higher you jump, or the more force you're putting into the ground, and so the stimulus just keeps on rolling because it self-intensifies. But we always start light. We always start light. If someone's not used to single leg hopping, then we will stop them. We'll just have them hop in place, and then from hopping in place, they'll have them hop forward at a very light intensity, and then gradually we'll have them hop, a medium intensity, and then we might start with a short run in, and then before you know it, after a few months, they're actually able to hop like off of like say a 10-meter run in, and they can do it at a very high level, like high intensity. Or if like hopping is too intimidating, then you can just do pogos. Like you can do pogo, split stance pogo, and then get into the hopping progression.
Okay, and when you say increase intensity, how do you impart that to the patient or the athlete?
Basically just effort and then limb displacement or limb movement. So like with going back to the hop example, or you could also use a bound. I'm not having them turn the leg over and going, basically a high knee or a tuck jump. It's essentially just like a single leg. It starts basically as like a single leg jump rope, essentially, and in terms of like how high they're getting off the ground, and then that will progress to a little bit more leg movement, and then a little bit more leg movement, and then now we'll add some like horizontal components to it. So,
Okay.
like, I mean, are you familiar? Are most of you guys familiar with what a single leg hop like looks like in terms of
Yeah, I
like
think
a kind
so.
of a tuck jump ish? Yeah.
Yeah, absolutely. Now tell me about like if you're getting into bounds, what kind of distance are you having to move, and what kind of rest breaks are you putting in?
Bounds would be we'd probably go. We don't usually do bounds for reps. We'll do distances, and it'll be probably anywhere from probably 20 to 30 meters, maybe out to 40 meters with some of our track guys. We always preach, quality over quantity, and bounds are really intense, especially on the back. A lot of our guys will get back pain with bounds, so we probably will only bring them out to about 20, maybe 30 meters at the max. So I don't know how many reps that is for. It'll vary on the individual, and then but just to start them out, we'll do the same thing with just going light, medium, intense, and then we'll check off their form, and then eventually they'll be able to bring the knee up and strike it down really aggressively, and making sure they're bouncing off the floor. In terms of rest periods, we're not super strict with rest. It's just on you. Like when you feel ready to go, you can go. Usually that's like 2 to 3 minutes. Sometimes if it's very intense, it might be 4 or 5 minutes, but usually it's like 2 minutes rest. So we're talking about like 3 to 4 sets of 20-meter bounds. We don't overdose plyos. That's one big thing that we don't do compared to other like jump trainers. Is plyos are only a supplemental thing to our training. They're not necessarily the main course. So we don't we so like I mean even 2 sets of 20 meters would suffice because it's already a pretty intensive stimulus.
Yep.
So you don't need to overdo it.
Okay, if that's the accessory move, what's your primary move in a program?
Sprinting and jumping.
Okay.
Sprinting and approach jumping. Yep. That's our bread and butter. Sprinting, approach jumping, and then progressive resistance training. So yeah.
Okay, like you said, leaving no stone unturned. Okay, let's get into the pathology side. So patellar tendon pain is so common, especially after like your bone tendon bone grafts. How do you approach these? How do you diagnose them? And then what's your first intervention um, to try to decrease their pain?
Yeah, just ice. I mean, ice for first interventions always is almost always ISOs. If they're above a 5 out of 10, we'll just put them ISOs for a few days or a week, depending on how long it takes to die down. That's really good for for reducing some inhibitions of the muscle, some rudimentary strengthening of the muscle, and then usually it helps to kind of desensitize the nervous system a little bit and almost always increase their pain if it's a tendon issue. And from there, once they're below a 5 out of 10, then we'll progress them to just our slow, heavy strength training, usually in the form of a slow quarter squat or a slow box squat to start out with, if they can tolerate a deeper range of motion. And once they can do roughly like 70% of their max back squat 1 RM, it slow for about 6 to 8 reps, then we'll progress them to the box drops. Then once the box drops, they can land from a box at the height of their max vertical, pain free, in a roughly a half squat, not like actually sinking down deep, like between a half and a quarter squat. Once that's pain free, then we'll get into our jumps progression. So that's kind of the 4 stage process that we do for our jumpers.
Okay, love that. I guess tell me what is your preferred ISO setup with the patellar tendonitis?
I love leg extensions. If you don't have access to a leg extension, wall sits are great, or you can actually just sit in a chair and just kick into a wall. That works great too. Specifically with leg extensions, I like doing them in a mid range. So probably between like 45 and 60 degrees. For myself, I'll go like 90 because I don't really have any tendon pain anymore. And then I want the seat all the way back so you can get the most rectus femoris development, because like that's what makes up the rec fem is what makes up the majority of your patellar tendon in terms of like the continuation of muscle fibers. So you want to try to maximize rectus femoris development through putting the seat all the way back on the leg extension. And
Dude,
then we'll
that little tidbit, Ben, like I know that's like that like the inside of your eyelids. That's fascinating to me. And news to me is my point. So rec fem is most important there. So you're
Mhm.
sliding the chair all the way back so you get more rec fem. Any other tricks to increase rec fem usage?
So that would be one. To grow the rec fem, you can do leg extensions with seat all the way back, or you can just do actually hip flexion exercises. So, and what's interesting about this, I mean, I don't know how much you wanted me to babble on about research, but
I do.
what's
Babble.
what's interesting about that specifically is you can do a hip flexion exercise, and you will still see increase in strength in a leg extension exercise, even though you didn't do any leg extensions, which I think is a kind of a cool, like kind of crossover effect. So I train both. I do rec fem both in the leg extension with my ISOs, and then I'll also do some hip flexion exercises. For the rec fem, but I'm also doing it for like iliopsoas because it's really important in sprinting. But
Okay, so
yeah.
I mean that makes a lot of sense. And then I'm even thinking like a banded resisted hip flexion with a band around your feet going
Mhm.
out into a knee extension. Then you're kind of hitting
Yeah.
both. And then just building on that, that's really interesting to me. I mean, it's not just a carryover effect, it's the fact that you're using mostly your rectus femoris when you're doing a knee extension. So if you're getting that stronger, then it carries over. That makes a lot of sense. Where the hell did that come from? Tell me about those
that's
studies.
from that's from shout out Jake Tura. He posted a study from like it was a cadaver study from, I think it was like 2016 or 2018 or something like that. And then I read it. I was like, oh, that's fascinating. And then so I think I made a post about it months ago. But
Okay, I
yeah,
love it. We
that's where
can
we got
yeah,
it
we
from.
can link to that. And dude, that's worth getting you on this phone from or on this call from Nebraska. Just that little bit. That's really great. So you're telling me that when I first got out of grad school and people didn't shut up about clams and the use of the glute in terms of knee pain,
Oh gosh.
that was just eyewash.
I won't say it's eyewash, but it's grossly overemphasized. I'm still gonna look at the entire chain. Like, I'm still gonna strengthen the calves if you have knee pain. I'm still gonna strengthen the hips if you have knee pain, and the hamstrings, because there is a force transmission aspect of it, a force sharing aspect of it. You have all of your connective tissues, your fascia that run everywhere, and if you're weak in one area, you're only as strong as your weakest link. But I can't tell you that I've done clamshells with any patient or with any athlete of mine and they have jumper's knee and then they report, yeah, that decreased my jumper's knee pain. Like it just doesn't work. Like you
Mhm.
have to load the quads, make quads great again, as I think Tim Riley says. So
Love that.
I agree. Yeah.
Okay, I love that. You didn't mention anterior tib. Where the hell did that come from with the knee
Oh,
over toes,
goodness.
guys?
Dude, I don't know where he got that from. I think it's a Charlie. It might be a Charlie Francis thing, or no, or not Charlie Francis, a Charles Poliquin thing, because that was his mentor. But I don't know. I'm not saying I used to be really anti like tib raises. Now I'm like, it's fine for like global function. Like if you have shin splints or an ankle sprain, like sure you can do them, but
Mhm.
like I don't think you can convince me that doing tib raises is going to help your jumper's knee at all.
Okay.
And I've
Uh,
never, and I used to have jumper's knee and I did tib raises and it didn't work at all. So I kind of just developed a confirmation bias there.
okay. Yeah, that makes sense. Talk to me about the concept of knee over toes. Doing lunges, driving your knee forward. How impactful or important is that in patellar tendinopathy?
That is one area I do agree with Ben on, not necessarily the knee over toe lunge, but just loading the quads and getting your knees over toes when you squat. So that's probably, in terms of things that I've learned in the last maybe year or two, with our guys, is a lot of them, especially with history of knee pain, absolutely hate to load their quads when they squat. So it's like they'll do their ISOs, which are fine, but like ISOs, unless you're doing them at an intense level, they're not going to do a whole lot for driving the needle for actual quad strength and even tendon adaptation. Like they're good for pain, warming up, reducing inhibition, but they're not going to really drive the needle, so to speak. And where you really get the most bang for your buck is like if you actually load your quads in the squat. Like we have all of our guys heels elevated on a plate, or if you have weightlifting shoes, wear weightlifting shoes. And we want you to put your knees over your toes when you squat. I want to see a positive shin angle. Don't do a hinged, like a super hingy powerlifting low bar back squat. We want high bar back squat or a front squat. Like I can't really back squat deep. So I use front squat or going to hack squat. And I want you to load your quads and and long term, that's one of the best things we found for um, both getting rid of jumper's knee, keeping it away, and then it also works really well for PFP. So
Yeah. Okay. Makes a lot of sense. I had early on when I first started the pod, I had Kelly Starrett on, and he made his fortunes talking about driving your knees out and avoiding this valgus concept. And I was asking about this, and he's kind of come around on this, saying like that's a way to cue overall lower extremity recruitment, I guess, by driving out. But he also is coming around on letting your knees go where they may. Where are you on varus, valgus when squatting, other cues that we can get impart upon the athlete?
that's a great question. I do cue knees out mostly because not like extreme. Like I don't know how extreme Kelly was back in the day, but I do cue, fan your knees out a little bit, externally rotate a little bit um, on the descent, simply because you can just get access a deeper range of motion a lot easier. And it's also really good, especially for athletes who might be a little bit more knock kneed. It's a different way that they can move their knee. And it's actually good for if you're maintaining full foot contact. It's a good tibial internal rotation exercise by fanning the femurs out. But the tibia stays relatively square. So now it's getting relative tibial internal rotation. So I do like it for that aspect. In terms of the way up, like the concentric portion,
Yeah.
you should see a little bit of knee going in. Like that's just internal rotation. I'm not trying them. I don't want them to activate their gluteus medius the entire time on the way up. Like I want them to be able to put force into the floor, and in order to put force into the floor, your knees have to come in. So they go
Yeah.
out on the way. So they go out on the way down, and then on the way in, as long as they're not like touching each other, I'm fine with seeing a little bit of knee cave, so to speak. But it's just going back to neutral. I mean, it's going
Right.
from
I was going to say you're
out
just
to
returning
neutral.
from
Yeah,
varus, right?
exactly. Yeah.
Okay, so that makes a lot of sense. You put up a fascinating post, and we'll segue into some of our sprint form and mechanics about a sprinter's ability to extend their knee and the timing of that relative to hip extension. Can you talk to me about that? I was really fascinated by it.
You mean like the elite sprinters don't achieve triple extension, that one?
It takes
Or
them forever to get there if they get there.
yeah, so when you're watching sprinters, whether it's acceleration or max velocity, if you're truly good, like if you have great mechanics and you actually get to frontside mechanics, you're not going to achieve full knee extension. I think a lot of people hear the term triple extension and they're like, okay, everything has to be at terminal extension. That's not true. Your knee does not achieve terminal extension. I don't think your ankle achieves terminal extension. Your hip probably gets close in terms of a sprint. And the reason being is because it just takes too much time.
Mhm.
If the amount of force, because in I have Rolf Mann's book, and the amount of force that you generate at that end range, that last bit of knee extension is like 15 pounds. So it's pretty much insignificant. And there's the trade-off between getting that last bit of propulsive force versus being able to actually recover the limb back to the front side. It's not a fair trade-off. And so all it does is just decrease, or it increases ground contact time, and it ruins the timing of being able to recover that limb to the front side so you can actually get in that high knee position so you can apply force
Coming
back
back
down, and it
down.
ruins your range
Yeah.
of motion. So you just end up getting into backside mechanics. This is where you'll see the anterior tilt and forward lean, especially with team sport athletes, and then you can run into some hamstring issues there. So there's just not so it's not necessarily something you have to think about. It only really occurs if the athlete doesn't hold good postures and if it's over cued by the coach. Like if the coach over cues, like, oh, you got to get to triple extension, like you got to, finish your push.
Mhm.
That's when you'll see it show up. But more oftentimes than not, if the sprinter just emphasizes frontside mechanics, the backside will take care of itself and you don't have to worry about it.
Okay. Okay. So when you're that was going to be my next question. When you're coaching these athletes and putting them back into their sprint mechanics, regardless of what they're coming back from, you're just focusing more of your cues on get your knee drive proper, your front side mechanics, and the
Hmm.
backside will clean itself up.
Yeah, yeah. Backside will take care of itself. Like Rolf Mann talked about, Carl Lewis, was barely like you would hardly ever see his knee get all the way back on his backside. Like it would basically stay in line with his hip or slightly behind, like very little hip extension. I like out because he was recovering to the front side so quickly, and he had quote unquote perfect mechanics. I'm not saying that's the way to run, but simply just emphasizing recovering the knee to the front side, getting I don't want to cue high knees, but getting a relatively parallel thigh, and then especially probably more importantly is attacking down and back. Like you want to make sure you're orienting the force vector in the direction you want to go. So if you cue attack down and back hard, pretty much everything will take care of itself.
Okay. That makes a lot of sense. I mean, I know a lot of track and sprint athletes talk about thigh separation,
Hmm.
and their ability to enhance that. I think that can get dangerous when you're talking about that if you're not cueing them as to where that separation should be transpiring, right? Because that's going to force them to like elongate their backside mechanics, slow them down in reproducing force. How do we avoid that?
Exactly. Yeah. Now thigh separation is really important. I think the numbers, if I remember from Dr. Ken Clark's post, it's like a good sprinter that I think between 90 and 110, so a little bit of a range there. But a lot of that comes from the front side, right? So it's a lot of it come like you were saying, a lot of it comes from having a relatively high front side knee. It does not come from overextending on the back end. And when you cue thigh separation, and that's your only cue, like rather than telling the athlete, "Hey, I want thigh separation, but this comes from having a pretty high knee position,"
Mhm.
then like you said, you're going to get into backside mechanics, and your form's going to turn to crap. So
Yeah, yeah.
yeah.
Okay, super helpful. Now, I want to talk about the difference between slow pace running versus sprint. How different they are, and I think this is a major gap when we get athletes back to run. Like up here in the let's call us the Northeast. We talk about the Delaware return to run protocol. So this is a jogging progression that is track based, and unfortunately, we go from that building up one's mileage to like 2 miles into then our return to sprinting. Walk me through the differences between a jog and a sprint from a mechanics perspective, and how you progress athlete through that.
Great question. So, in terms of just, I think it's easy to look at a run and versus a sprint and say, oh, the shapes are somewhat similar. You have a little bit more front side in sprinting, maybe a little bit more backside in running, but for the most part, they're similar. But, if you listen to elite track coaches talk, like, Stu McMillan comes to mind here. He's like, running and sprinting are completely different gait patterns. And the force plate data would back this up. Like, if you look at a force time curve of, say, running at 6 meters per second versus sprinting at, I think it starts to switch over about 9.5 meters per second. The curves look completely different. Like, you have this big spike in the first half of ground contact time when you're sprinting, and then the back half is relatively the same. Like, that's the difference between elite sprinters and non-elite sprinters, is their ability to spike that ground reaction force in the first half of ground contact. Because that allows them to create the vertical impulse they need for stride length in less time, and then so they get faster. Like, I think some people think that running is just like more, or sprinting is more forceful running, but the curves are completely different. And I think that also points to the coordination is completely different. Like you mentioned, Coach Q was talking about the hamstrings,
Yep.
and like, even going from 88% to 92% velocity is a massive difference with the force required from the hamstrings to decelerate the shank. And that again points to, we can't prepare athletes for sprinting just by doing a bunch of running. Like,
Mhm.
even a bunch of running at 70% won't prepare you for sprinting. And it's incredibly important to gradually expose them to that max velocity. And then how I do that is relatively simple. I mean, it's just, what can you tolerate? Like, take a muscle pull, for example. Um, I will say, okay, sprint, like, just run at 60% or 70% effort. If that feels good, next session, we'll go from like 70, 75 or 70 to 80% effort. If that feels good. And then, of course, we're doing some weight room stuff along with it too. And then I'll just keep going until tolerance. I don't think doing, things like hamstring switches or, like ISO catches in the weight room is bad, but at some point you got to return to the thing.
Yep.
And I think sometimes clinicians live in the area of like, oh, you can't start sprinting until you can hit this certain number on a Nord board, or you can hit this, or you can do this, hit this number on an ISO switch for the hamstrings. And then, okay, now you check that box. Now we'll get back to sprinting. I don't really do that. I just say, hey, we're going to progress you to tolerance. And eventually they're going to be able to tolerate 80%, and they'll be able to tolerate 85%. And then just week by week, session by session, we work them all the way up to 100%. And then once they can, and then once I'm at 100%, I'll just give them a very low dose. Okay, we'll do 1 or 2 sets. Say we'll go to 20 or 25 yards. So I know you're hitting max velocity for maybe 5 yards. And then now we'll bring it out to 30 yards, and then to 40 yards, and then eventually try and get them running to some 60s to where they're actually getting max velo for about 3 seconds.
I,
I think
I
that's
think
where I want to see.
I mean, I think the misunderstanding of the mechanics of the sprint or high intensity running versus jogging or low intensity running is a massive issue as it pertains to return to play from any given injury. I mean, and I think we're coming around on this with ACL stuff. I think we have a long way to go with Achilles ruptures and repairs, where we're locking these people up in a boot for so long, and then it just takes forever for us to even get back to sprint mechanics. It's because we don't touch the beginnings of those sprint mechanics, or more importantly, load and forces, until so far down the line. So I think it's a tremendous opportunity to start reintegrating some of these forces along the entire spectrum of rehab, not just like you said, once they pass a test, then we're going to start introducing it. I also think like our early intro is like, you'll pass a Tendon test or you'll pass your force plate analysis and be like, okay, now we're going to start sprinting. And that's just way too much load if it's not graded appropriately. So I think there's tremendous amount of value, not just at end rehab stages, but throughout the entire process.
I agree. 100% agree.
Yeah, we got to get better at that as a profession. Okay, give me the number one mistakes you see um, by physical therapists when treating Achilles tendinopathies.
Uh, they don't load the calves heavy enough. I'm sorry, but I don't think, is it Anderson or Aderson protocol, the whatever the guy's name was that invented the eccentric calf raise, the 2 up 1 down for
Yeah,
whatever
I don't know,
15.
but
I don't know if it's off the top of my head, whatever that was.
yeah,
That's not enough for athletes. That's not even close. Doing the 3x15, 2 up 1 down, whatever it was, 2 or 3 times a day. That's great, for Shirley, who's 65 maybe, but for an elite athlete or even a high school athlete, they need to load their calves way, way more than that. So we start them off outside of ISOs. We'll start them off with just slow, heavy strength training. If they can tolerate going to a deeper range of motion, like if it's more mid portion, not insertional, then we'll have them low, like we'll really have them emphasize that bottom range of motion. If they can't quite tolerate that left, like yet, like if they're getting flare ups or their pain's not staying below a 3 out of 10, then we'll just do top range because it's better than nothing. And then as tolerated, we want them to be able to go to like an overcoming ISO, say like a 5 second push, whether that's in a seated calf or standing. And
Does that
then
matter? Does that matter to you? Is one more important than the other? Soleus versus
I
gastroc?
do both. I do both.
Okay.
I think the soleus is grossly underdeveloped, and I think the gastroc can get a lot, not necessarily overdeveloped, but overdeveloped relative to the soleus. So we like to do both. I know some
Okay.
people would probably fight me on that, but
I'm
we
with you. I
we
don't
do
see a
both.
reason
Yeah,
not to. I'm not
yeah.
going to fight you.
Yeah, and also it's just usually a seated calf is more comfortable too. So, and
Okay.
then
And
from
when you back it for 1 second, when you say we're not loading enough, what are the ranges we should be loading? And not ranges of motion, but loads that we should be moving.
oh yeah, so in terms of like rep ranges would be, we go 3 to 6, four to
Okay.
eight, heavy strength training, like 80% plus every 1 RM. We don't necessarily have benchmarks in terms of I can tell you our benchmark for a double leg standing calf raise. I will say, I'll preface this by saying a healthy athlete in a Smith machine is 3 times body weight. So our
Okay.
really good dunkers, say they're 200 pounds, they can, from a heel elevated or from a 4 foot elevated position, can do about 3 times body weight, 2.5 to 3 times body weight in a double leg calf raise. Now, for single leg, obviously that's a little bit different. We don't necessarily have a set standard. I would say a good rule of thumb is if you can get close to your body weight, probably about 90% or so of your body weight on a single leg calf raise in a Smith machine, that would indicate to me that you have strong calves. And like that's in a 1 RM. I couldn't tell you what that would be, like what you'd be repping out, but that would be like our rough standards.
Okay, that makes a lot of sense. You're definitely right that I don't think we're doing that nearly heavy enough. So that's definitely a massive mistake there. And would you say the same thing on soleus with a
Yeah,
seated
and
knee?
yeah, solely I just don't think we just don't do seated calf raises. Like I think people read there's like that one study from 2022 that says that, oh well, the standing calf will grow the soleus the same, as or basically the same as a seated calf, but longitudinally over years that gap might be a lot more than we think. And I talked to Rolf Ullman, who trained Su Bingchen, who's like the fastest 60-meter accelerator ever. And he was like, that's a problem in China. He's like, the athletes just do standing calf raises. Their gastrocs are really overdeveloped, and they have absolutely no plantar flexion strength with the knee when the knee is bent, even though the knee's bent in sports.
Yep.
So I think not only from a developmental standpoint in terms of like just muscle size, but also just from a coordination standpoint. And then doing that in a variety of manners. Like it doesn't just have to be a seated calf. It can be, being in a split lunge and doing it on a belt squat or something. Like it can be a variety of manners that you can train that. But just training bent knee plantar flexion strength is the point. Yeah.
Okay, so with all this research, and if we're loading it so hopefully better, more efficiently, heavier than in the past, why do we see all these Achilles ruptures?
Oh, that's a loaded question. It's something I think
Yeah.
about often. I think I think number one, it's a coordination. It's a coordination issue. It's a inability to create pretension, especially when the foot is behind the body, like in that negative step. And because of that, because the muscle tendon unit is slack when the foot is hitting the floor, that causes the heel drop. If they were creating pretension, whether that's because of they are fatigued or because they're not familiar with that position, or they just don't have a large reserve because they're fatigued. It's because the muscle tendon unit is slack, it takes longer to take up that slack. So then now you're getting to that heel drop position, that longer muscle length, especially when the foot's behind the body. And now when the muscle can finally produce force, you're getting this kind of like belt or towel snap effect. So now the muscle's finally able to pull on the tendon, which moves the bone, but the heel's already basically down. And then you're getting this towel snap effect, and like that's where the rupture happens. I mean, it happens in the mid portion. So that would make the most sense to me. And then along those same lines, I don't think the tendon itself is as strong as it could be, especially for elite athletes that are going to be putting a lot of force through their bodies and need the tendon to have a very high capacity because they're playing, say 48 minutes or 40 minutes in a basketball game. Um, and the tendon just might not be healthy because, like, I just don't think, take NBA guys for examples. I don't think NBA guys really train their calves heavy at all. So I think they have just low calf strength in general. I think their tendon just isn't as strong as it should be relative to what they need it, relative to where they need it to be. And then part of it's just like load management, and then they're just fatigued. Like it happens in the playoffs when they're playing at the most intense level they've seen all year. Some of these guys have taken, say, almost 2 weeks off because they haven't played a game, and then they get into the playoffs, and then now they spike their workload. Maybe there's some underlying tendinopathy there anyways, but I think it's a coordination issue, and then it's just a general strength issue too.
Okay, so I understand the general strength issue. I hire you to make sure that my New York Knicks don't have an Achilles rupture. What's the first thing you're putting in to prevent that?
Whew, great question. Um, I would say I want to see. I would say I'm gonna go two things.
Okay.
So the first one is I want to see NBA guys be able to do plyos at a competent level. I think if you can do that, that will build pretension abilities, that will build a reserve that they can use when they're fatigued, and they'll be okay. Because when I watch NBA players train, I am just not impressed. Like even in a rudimentary pogo hop over 12-inch hurdles, they look terrible. Like they're
Mm.
great athletes, but even in that isolated setting, they look terrible. So I want to see NBA players be able to do like hops and bounds at a high level. And then I would also, along that same continuum, I would want them to be able to sprint with good mechanics at a high level, because I think that is indicative of them being able to create pretension and have, good ankle stiffness. And then the other intervention on the other side of things would be just getting really strong in the calves, like making sure they're hitting their calves, say 2 to 3 days per week, seated and standing. Can they get 3 times body weight or 2.5 times body weight in a double leg calf raise? Can they get close to a single leg, close to body weight in a single leg calf raise? And then just load up as much as you can on a seated. And I think if you can do those things, you're going to reduce your risk a lot. And then I would say also exposure to the negative steps. I think they do it in a setting where it's super, super chaotic, and they don't do it enough in an isolated setting. Like I don't think they develop the coordination in the negative step in a setting where they don't have to react to something. So I think
Mhm.
even just doing some negative steps in an isolated setting, maybe at a faster level than you would normally do it, is a really good way to train that. And then also training that position in the weight room. Like you might have seen I think Joey Burgles does some like calf raises with the foot behind the body. I think that's a great way to also train that position too.
Okay. And when you say training that negative step, they're starting in a square position, driving, let's say, their right leg behind them to propel them forward.
Yep.
Reset, repeat, reset, repeat.
Yep. And then
Um,
because like that'll train the coordination piece, because there's also like there's a pre-tension at the calf that we need, but there's also the co-contraction at the hamstring that we need. Because if the knee extends too early, then that gastroc is getting super lengthened, and that whole muscle tendon unit is going to be more susceptible to lengthening. So also training that delayed knee extension is just as important. So I think
yeah.
that's another reason to train it.
Well, I mean, I'm thinking like you're sharing forces, right? Like if you don't
Mhm.
get to a totally extended knee or a hyperextended knee, you're able to use quad, you're able to use ham, maybe some more glute, but it's definitely taking stress off of
Exactly.
your triceps surae. So maybe that could go a long way. It is amazing. Like you talk about, I want NBA players to be able to sprint at a high level, and we talked earlier on in the conversation about what that means. These guys are terrible movers. They're insanely elastic. They're terrible movers because their limbs are so goddamn long. They don't work on given, let's say, ranges necessarily. Although I think there's some great ones out there that work on this stuff. I had some great conversations with David Alexander down in Miami about it. But you don't see that stuff. You just see them playing a whole bunch of ball or doing box jumps, and that the nuance of sprint mechanics I think is not there. So it's a great point. Ben, you're hired for the Knicks. We'll take you, dude.
Appreciate that.
Yeah. Okay. Dude, you have been awesome. I could talk to you forever. Thank you so much for your time. Tell everyone where to get your jump programming, how to find you on Instagram.
Yeah. So if you want to sign up for coaching, I'm a coach over at THP Strength. So you can sign up for my coaching at thpstrength.com. And my Instagram is @athleticdoc if you're interested in all things human performance. But I appreciate you having me on. This is really fun.
Dude, you are awesome. Thank you so much. Guys, thank you so much for listening. I value every single one of you. Check out all of Ben's programming. It's really unbelievable. Check out our ACL course that we mentioned, True Sports PT. Let us know what you love. Let us know what you hated. Thanks for listening. Bye-bye. Bye-bye.